Hello medicos, today we are going to see the use of amiloride in cystic fibrosis and lithium-induced nephrogenic diabetes insipidus. Amiloride is used as a diuretic. It is a ENaC channel blocker, which is epithelial sodium channel blocker. It is also used in cystic fibrosis and lithium-induced nephrogenic diabetes insipidus. What is cystic fibrosis? Cystic fibrosis is a autosomal recessive disorder in which there is deletion of delta F508 gene. It is the most common mutation. Cystic fibrosis can also happen because of other mutations too, but the most common is delta F508. Here F stands for phenylalanine. Due to this mutation, there is abnormal protein folding and degradation of CFTR before reaching the cell membrane. What is CFTR? CFTR is cystic fibrosis transmembrane conductance regulator. This is the structure of normal CFTR. It has two transmembrane domains which has 6 alpha helices, and it has a nucleotide binding domain to which the ATP binds and hydrolysis takes place, and there is a R domain regulatory R protein. When ATP binds to this nucleotide binding domain and hydrolysis takes place, there is opening of this CFTR protein, and it is enhanced by phosphorylation of this R domain. It is done by this protein kinase A and protein kinase C. They will phosphorylate this R domain and it will enhance the conductance of the chloride ion. Let's see what happens in cystic fibrosis. The function of CFTR, the cystic fibrosis transmembrane conductance regulator, is tissue specific. Its function is dependent on tissues. In sweat glands, in normal sweat gland, it works like this is the cell. These are the cells. This is lumen of sweat gland duct. See, I can say this is a CFTR. Okay, this is CFTR. This is ENaC. Normally what happens in sweat glands, CFTR will transport chloride ions into the cell, and it will also augment this ENaC channel. ENaC channel will bring in the sodium, and CFTR is augmenting this ENaC channel, so there is absorption of sodium and chlorine from the sweat. What happens in cystic fibrosis? Okay. In cystic fibrosis, we saw that CFTR is degraded before it is reaching the cell membrane. When CFTR is not able to reach the cell membrane, then there will be no movement of chloride into the cell, and it was also augmenting this ENaC channel for absorption of sodium. Now, when the CFTR is not present, there will be no augmentation, so sodium will be present in the lumen of this duct, and chloride will also be present. So there is increased sodium chloride in this sweat. So there will be production of salty sweat. In children who have cystic fibrosis, we can see they will be having salty sweats. See, the function of CFTR is tissue specific. So in sweat gland it was working like this. In respiratory tract and gastrointestinal and reproductive tract, its function is different. See, these are epithelial cells. In normal, see, this is mucus. This is CFTR. This is ENaC. See, normally what happens? There is movement of chlorine outside this from the cells into the mucus, and there is inward movement of this sodium into the cell. And what this CFTR will do, CFTR will inhibit this ENaC channel. So normally what happens, see, normally when there is inhibition of this ENaC channel, then sodium will be present here outside the cell in the mucus, and chlorine is sent out by the CFTR. So there will be movement of the water into the mucus. So there is increased fluidity. So the mucus can be expelled out, like it can be cleared from the respiratory tract, GI tract, and from the reproductive tract. But in cystic fibrosis, see here, see, in cystic fibrosis we don't have this CFTR. Okay, now the inhibition which was done by this CFTR will not be there. So what happens, chlorine is not moving outside. See, this is mucus, chlorine is not moving outside, and the inhibition by the CFTR on ENaC will also be not there. So there will be more sodium influx, and chlorine is not moving outside. So there is less concentration of salt in the mucus. So water will move inside. So what happens? The mucus becomes dehydrated. Because of dehydrated, the mucus cannot be cleared. So there is less mucociliary action. So what we can do, see, already in cystic fibrosis we are not having this CFTR protein. Okay, and there is ENaC channel which is working more. So there is more sodium influx. So if we give amiloride, it is a ENaC channel blocker. Amiloride will block this ENaC channel. So what will happen? There will be sodium will not move inside. So there will be sodium will be there lot in mucus. So what will happen? There is movement of water into the mucus. So it will increase the fluidity of the mucus. So the mucus can be cleared. So amiloride given in aerosol form, it can provide symptomatic relief in patients who have cystic fibrosis. Let's see how it is useful in lithium-induced nephrogenic diabetes insipidus. See, this is cell, this is collecting duct cell, and this is aquaporin 2, here aquaporin 3, aquaporin 4. This is basolateral, this is apical, luminal side. Okay, and here there is ENaC channel, this is sodium potassium ATPase, and here we have a receptor for vasopressin. This is B2 receptor, vasopressin receptor, and it is GS, G protein coupled receptor GS, and here it is adenyl cyclase. So what we GS will do, it will stimulate this adenyl cyclase. So there is conversion of ATP into cyclic AMP, and there will be formation of more protein kinase A. So what will happen? There will be phosphorylation of proteins. So it will produce more aquaporin 2. So what happens when vasopressin acts on this V2 receptor? Because it is GS, there will be more production of aquaporin 2. When aquaporin 2 are more expressed on the apical membrane, when then what will happen? Then there will more influx of the water. Water will be reabsorbed. But what happens in lithium-induced nephrogenic diabetes insipidus? The lithium will enter through this ENaC channel. Lithium will enter through this ENaC channel, and it will inhibit GSK3 beta. GSK3 beta is glycogen synthase kinase 3 beta. Okay, when it is inhibited, there will be the inhibition of this adenyl cyclase. So what will happen? This lithium is inhibiting GSK3 beta, and GSK3 beta, because of inhibition of GSK3 beta, there is inhibition of adenyl cyclase. Then there will be less protein kinase A formation. So there will be less aquaporin formation. So water cannot be reabsorbed. Water is excreted. So it is causing nephrogenic diabetes insipidus. So what we can do by giving amiloride can block this ENaC channel, so lithium will not enter, and the lithium induced nephrogenic diabetes insipidus can be prevented. Thank you.